My name's Sam Daugherty. I live in Big Rapids. I've been the CEO of Mecosta County Medical Center for about 18 years, and for the last 2 years, the CEO of Reach City Hospital. This is the 30s, the old original hospital. This is the 70s, the Taggart Wing, the hospital sort of changing its structure, but staying in town, but improving, which is kind of what we're trying to do now. This is the 80s, where we added on the emergency room, and at this point in time controlled by the county, and as it is currently. This is the 90s, the new birthing center and the rehab center, and of course now we have the emergency room over here, the surgical suites up here, and a new main entrance here. The bond issue was passed in Mecosta County. It was $11 million. It was for an emergency room, operating room project. It's 4 new surgical suites, 18 emergency rooms, beds, etc. It's been a phenomenal project, and it's really helped the hospital grow. And that actually is a large piece of this merger, having the rest of that debt paid off by Spectrum. 2005, the ER-OR project actually opened. And as we tend to do, we get restless after we complete one project and we start into another one. We looked around, and the next project that we felt strongly about was single patient rooms. If any of you have been to the hospital and been an inpatient, you know we still have small rooms, 1 small bathroom, and 2 beds in that room with a curtain pole. Pretty much the standard today is an individual room that's bigger, handicapped, accessible, showers, full bath, 1 patient, etc. So that was our goal. We started looking at replacing some of the infrastructure, the chillers, the boilers, HVAC, so on, in the hospital. When we put a price tag to it, it was about $44 million. We knew that was impossible for us. There was no way we could come back to the public and ask for another millage when we were still paying off the $11 million that we currently receive. And we started to think outside the box. What can we do? How can we raise money to keep going and make the hospital grow and solidify the hospital? So we started looking. That's how this started as far as the hospital approaching Spectrum. Would you be interested in us as a hospital? Would we fit into your business plan, your market area, etc.? Spectrum said yes, we'd be very interested. We have what I call a major artery, 131 that goes up and down this part of the state, right by Big Rapids and right to Spectrum at the north end of Grand Rapids. So the hospital board approached Spectrum. Spectrum was very interested. The hospital board actually did a whole process, held public meetings, voted 9-0 to recommend to the county commissioners, never actually put it in the hands of the county commissioners because in 2008, that's when the economy tanked. On hold for a couple of years. Spectrum came to the hospital board and said, we've got an idea. And this really was fortuitous, I guess. It was just something that happened that nobody planned. The CEO at Reach City left. Spectrum says, why don't we have Sam run up and down the road and take an inside look at how Spectrum operates hospitals out in the country, and at the same time, we'll assist you with your medical practice, employed physicians, which is really kind of the state of the art now. Control would leave the hands of the county commissioners and go to Spectrum, but the day-to-day operations of the hospital still would have a local board guiding it. Fear of losing jobs, it's a natural fear, but we haven't seen it. The transition team of the board that was assigned to study this project and make recommendations visited Gerber, visited Greenville, and has talked with Reach City Board probably at least 5 times at this point. Cannot find any indication of any job loss, downsizing, etc. It's just the opposite. Fear of the unknown is natural. Positive aspects. Reduced purchasing costs. We know for a fact this past year, being into purchasing with Spectrum, that we saved over $600,000 just purchasing products with them. We're currently in a network. If you're an owned hospital, you get the highest tier of reduced costs. It's ranked as one of the top 10 health systems in the U.S., has a reputation reputation for exceptional quality and is financially strong. We are convinced they represent the best long-term strategy for the hospital.